I'm Cynthia Grueber, and I'm the Chief Operating Officer for OHSU Healthcare, representing Oregon Health and Science University. OHSU is the state's only academic health center, and our mission in Portland, Oregon is really fourfold: patient care, research, teaching, and community service. Our healthcare system operates 576 licensed beds, and last year we provided over 735,000 ambulatory visits in 15 locations throughout the greater Portland area. We offer a full complement of primary and specialty services, which may otherwise not be available in the Northwest region. The acuity of our patient population is very high. For example, our Medicare CMI is 2.2688. It's the third highest among other academic health centers across the country. We also operate a National Cancer Institute designated cancer center, and we are the only one located between Seattle and Sacramento. And through our OHSU Knight Institute, we are able to bring NCI-supported research and clinical trials to patients throughout the region. I wanted to share one very important example of how the potential cuts in Medicare E&M management services would impact our organization, and that relates to our oncology practices in the community. In 2008, a private-owned multi-site oncology practice in Portland was struggling financially, and they approached our organization for help. OHSU decided to acquire the practice, enabling those patients to continue to receive oncology service and actually increase the access to the services provided at the academic health center. We provide access for the Medicare patients, but I think we also, through this acquisition, help to raise the standard of care for this patient population in at least three ways. First, as part of a hospital outpatient department, we had to make significant investments in the practice in order to meet the higher standards of licensure, accreditation, and regulatory standards. The most significant operational example is the introduction of pharmacy techs, pharmacy technicians, and pharmacists to the sites in order to prepare the chemotherapy medicines. Prior to that, they were mixed and administered by nursing staff alone. This brings an added safety feature to the practice and is an important accreditation requirement of the Joint Commission. We also had to make some modest facility changes, again due to licensure requirements, but a very significant investment in our electronic health record as we brought these practices in the system and wanted them on a common oncology platform. We made an investment of over $1 million in order to provide the same kind of electronic health record for oncology, whether it was in the community practices or academic practices on the main campus. Second, as part of the integrated health system, patients not only have improved access to, they also have improved access to patient and family support services that aren't typically available in a private physician office. Some of those include social work and counseling, specialized pain management services, outpatient pharmacy services, rehab, and a comprehensive palliative care program that our organization sponsors. Not to mention the better access to inpatient and emergency department services should they need them. Finally, as a result of the integration of our community oncology practice at OHSU and within the Knight Cancer Center, a larger number of patients now have access to our world-renowned cancer research and leading-edge technologies. Our NCI-funded clinical trials that take place at OHSU are available for, more readily available to more patients now with this acquisition. In some cases, the cancer prevention and treatment regimens being studied are available nowhere else in the region.